Today, the North Dakota Department of Health confirmed 42 additional cases of coronavirus disease, COVID-19, out of 1,117 tests. This is a record day in terms of number of testing, in terms of tests total per date that we're reporting, and first time we've surpassed 1,000 tests, so that's good news. We've said in last week that we're working on doubling our testing capacity, and this is progress in the right direction. So shout out to all the people at all the testing facilities, both our state lab and others that contributed to this date. When we get our denominator up and our numerator down, that helps our percent rate. So again, also another piece of good news that our confirmed positives, 3.8%, our lowest in 9 days, going back to April 11th when it was 3.18. So this takes us off that higher rate that we'd been on end of last week and through the weekend, so that's good news. However, I'm very sad to report that yesterday was so far the deadliest day so far for North Dakota since this pandemic began. We had 3 deaths in North Dakota yesterday reported. A man in his 70s, a woman in her 80s, and a woman in her 90s. All 3 were from Cass County. All 3 had underlying health conditions. First Lady Catherine and myself extend our deepest sympathies and prayers to the loved ones of these who've recently passed. Again, we know that the elderly and those with underlying health conditions are the most vulnerable to this virus. This is the population that we're working hard to protect. These 3 deaths confirm this vulnerability. And as Catherine and I both know from experience, that regardless of age or circumstances, it's always difficult to lose a parent or a grandparent. So again, our thoughts and prayers go out to all of these from your loss. North Dakota has conducted 14,747 tests with 627 positive cases. This brings our average positive rate to 4.3%. That's that trailing 14-day number that we're looking at, that we want to see that trailing number go down. The positive news about that 4.3%, even though it was creeping up some last week and over the weekend, it is still the 5th lowest rate in the country. So only Hawaii, Alaska, Montana, and West Virginia have lower rates than we do in terms of the percent positives. And of those states I just mentioned, North Dakota is testing more than any of them because we remain number 10 in the nation on per capita testing. And this is an important factor because you might have low cases if you were doing low testing. If you can have high testing per capita and low percentage positives, that's a good place to be. That's where we've been, and that's where we want to stay. As we've talked about, again, we're working to double our tests and then double it again after that. And again, part of the way we've done that is adding not only new machines, but also more staff and then running more shifts. So in addition to the 22 lab FTEs at the state, there are now 28 North Dakota National Guard members and 1 Department of Emergency Services FTE working at the lab. And we're now moving towards supporting 7x24 operations or round-the-clock operations at the state lab. So again, thanks to those teams that have put that into place. With today's results, we now have 425 active confirmed cases. We've seen 189 individuals recover, and again, sadly, 13 deaths with that +3. Currently, 17 are hospitalized. This is up 5 from the last time we met live on Saturday. So hospitalizations up, but still extremely low relative to our capacity. North Dakota's active cases rose again today. When we take a look at the case trends slide, we can again see that the curve is heading skyward here. 42 new cases, no recovered cases, but a net of 39 due to the 3 deaths which we've discussed. On the positive rate rolling average, If we look at that 14-day average, which again is this one of the criteria for that the White House has given as a guideline for what they call phase 1 reopening, we have been able to flatten that out with a lower percentage that we got today after seeing some fairly steep increases there at the end of the week. Just as a reminder, I know again part of this doing more testing, having a lower percentage of positives on this slide is one of the things that we'll look at as we move towards reopening businesses, of course, in an incremental and methodical and safe manner as a part of our North Dakota Restart program. But I do want to remind people again, and maybe multiple times today, that the majority of the economy in North Dakota remains open. All of agriculture, all of the energy segment, all of healthcare, education, both K-12 and higher ed is being delivered through distance, but those institutions are all running and active every day. And so we've got wide majority of our economy still going. And again, as we talked about those executive orders, 27 of the ones that we put out related to cutting red tape, only one related to closing businesses. And those are businesses where we had high opportunity for transmissional contact, like personal care businesses or bars and restaurants. And of course, restaurants are still open for takeout and off sale. And so we are working hard to make sure that we can keep our economy moving forward. And let's take a look at the active cases by county. What of course jumps out in here and people gravitate towards is often the absolute numbers. And yes, in our most populous counties like Cass County, we've got and Grand Forks, we have 46% of the active cases in the state are in those two counties. We also said we were keeping a close eye on Minnesota, and in Clay County now has 62 cases and 3 deaths, in which of course Clay County includes Moorhead, Minnesota. We now have a positive case in each of the counties that border, in each of the Minnesota counties that border the eastern edge of North Dakota. You'll see on this slide that there are some states now that are white. They've got 0 active cases. Some of these used to have cases, and they've cleared their chart either one of two ways. Either people have recovered or they've passed away, but that's why we're fortunate to have swaths of the state that currently have no active cases, and let's keep working to keep it that way. When we take a look at the next slide, when we take active cases per capita, I again want to show this because we get away from just those absolute numbers, but to relate it back to the percent population. And you can see here that we have in Grand Forks, because of the targeted testing we've done up there at LM Wind, which we'll talk about some more in a moment, that drove that up to 19, almost 20 cases per 10,000 individuals. We have other counties with lower population in the west, including Dunn, which is slightly higher than that. Again, that's an area where we've done targeted testing. Montreal, we've done targeted testing, and we've done quite a bit of targeted testing in Fargo around long-term care facilities. And so those are again, I think reflects the work we're doing on our rapid response teams. And let me just recap that again on the rapid response team. But this is a coordinated effort between local public health officials, North Dakota National Guard, and affected groups, as well as our North Dakota Department of Health. And we're able to, mobilize a team, get people out there, do that targeted testing, and this helps us identify those. If we have a cluster of positives, we can identify they've been in contact with, identify more positives, do the contact tracing, do the quarantining and isolation. And this is a skill that we have to have if we're going to reopen the economy, is to be able to do that. And we want to talk a little bit about the most recent case example of now we've got more complete data about testing from the LM Wind Power that occurred last week. And as you know, this is a large, sophisticated manufacturing plant where they build wind blades out of wood and fiberglass. There's about 900 team members that work there. LM Wind Power is owned by GE, and they've been a great corporate citizen. They there was 8 employees that tested positive. The state was notified of that. They closed the plant for 2 weeks. They're doing a intensive disinfection and cleaning of the plant. GE LM Wind Power is paying all of those employees while they're on this during this 2-week plant closure, and they closed. On Wednesday, our team was up there on Thursday. We were able to run 426 tests through the drive-through testing, and of that, 99 were positive, 323 were negative, and we have, of those, 72 are LM employees, 19 are still under contact tracing investigation. 8 of them were close contacts, but not members that were working there. And there was another 29 LM associated positive tests resulting from the outside testing that was done at locations like Altru. So 128 is the total number of positive cases associated, either employee or close contact with LM Wind Power so far. That number may increase. And again, for netting this out, 11 of these are not in the numbers for North Dakota because 11 of those individuals who tested positive that work at LM or close contacts reside in Minnesota. We also know that when you've got an outbreak like this, it can jump from one organization to another. We did, as has already been reported, we had one positive case identified at the state mill and elevator over the weekend on Saturday. General Manager Vance Taylor has been communicating with our office, with the team members there, and with the media. That individual was a roommate of an employee at LM and did not work after experiencing symptoms, was tested on Thursday, last Thursday, the same day we were testing at the plant. He was working on a night shift. The mills directed this employee and others who were working on that same crew, so it was a small number of people, to quarantine at home for 14 days or until proven non-contagious. And of these 10 that are being that are quarantining at home, 4 of those are getting follow-on testing, and Vance Taylor has worked closely with the Department of Health and others to make sure that break rooms, locker rooms, work areas, and equipment have been all been cleaned, and then the plant is State Mill and Elevator is gearing up for reopening. We know that that one of the things that we are all focused on is getting back and getting everything open again. Last Thursday, the President released his Opening Up America plan, and we continue to take a look at those guidelines for phase 1 and those recommendations and how they can work for North Dakota and how it relates to our own previously announced North Dakota Smart Restart plan. We recognize, as the White House does, that each states are on different timelines, each state's on a different curve, and that the virus itself doesn't acknowledge or abide by any particular calendar, no matter how aspirational we are. And as I said previously, we've got an easier task than almost any state because we did not shut down our entire economy, leaving open agriculture and energy, manufacturing, healthcare, and education. Some businesses have closed or scaled back on their own. These would include dentist offices or elective surgery businesses. Certain hospitals and clinics have slowed or stopped. That was to preserve hospital capacity, in some cases PPE, and we appreciate them for doing that. But as we've said last week, any business that was not closed by an order of ours is eligible at any time to chart their own reopening path. And again, and whether that's hospitals doing elective surgery or dentists restarting, we'll continue to communicate with them, but they are not under any orders from the state. And so they're all eligible to continue their businesses going forward. Those businesses that we did select order to close, again, that narrow group, which includes bars and restaurants, theaters, gyms, and personal care businesses. Those that have a higher risk of person-to-person contact. We're working with those business associations as part of North Dakota Smart Restart. Our team at Commerce on the economic resilience in the North Dakota Smart Restart Task Force, working with them to develop standard operating procedures that keep business owners and especially their team members and their customers safe. Today we had a great call with Vice President Pence, Dr. Deborah Birx, CDC Director Robert Redfield, and others that leading the coronavirus task force at the White House, and other governors from across the country. The key focus today was how can all states be ramping up their testing. So that was right in line with all the work that we've been doing here in North Dakota. But I think one thing is clear from that call and from talking to, again, nearly all the governors in our region over the weekend, that everybody wants the same thing, is to safely reopen our economy and get Americans back to work and get our economy back on track. As we do that, we talked about our step-by-step plan for reopening was going to include 8 things that we needed to do. Sufficient health care capacity is the one that we've added a check mark by so far, because we feel with the surge plan announced last week and with the hospitalization numbers that we are in really good shape on that one. We'll continue to update the slide going forward in terms of our progress. As I've just said, we are working on new standard operating procedures. We feel quite good about where we are in terms of having PPE, but 2 of those areas that we want to focus on a little bit today, or make an announcement on today: widespread rapid testing and robust contact tracing. As I've said, these are skills and capabilities we're going to have as a state for months, or perhaps all the way up through we have a vaccine and are able to deliver it. So maybe it's going to be 12 to 18 months or longer. These are going to be new things we have to deliver. Fortunately, with the federal funding from the CARES Act, states have received money for building out this kind of capability, and we're working closely with the CDC and the White House and their teams on how to do that. One of the things that Dr. Redfield from the CDC announced today was that they were planning on putting over 500 people initially, going to 1,000 contact tracing people in the field. A minimum of 10 per state would be delivered from the feds, and this would complement what we're doing here in North Dakota. But knowing that we're going to have to build essentially new capability from scratch, we've been kind of building it while we're flying the plane the last 4 or 5 weeks. We knew that this is going to go beyond the capacity and capability we've had, because as we said, when you think about testing, it's not just what we do at the lab plus what happens at the providers at point of care or in providers' labs. Testing is going to be something that almost every business, certainly anybody who's a major manufacturer, has a lot of people working in spaces where they're working close together and can't maintain that distance. They're going to have testing as part of their normal course of business going forward. So we're happy to announce today we've been looking for and happy to land 2 leaders that are going to come in and help lead these efforts. And so that is fantastic that we have that. And let me talk about the first one, which is Brigadier General Robert Schulte. If we can pull that slide up. He will be leading our statewide testing team. General Schulte has been the Chief of Staff for Air Joint Force Headquarters, North Dakota National Guard. He's a Mandan native with a doctorate in health professions. He was Medical Group Commander for the North Dakota Air National Guard from 2012 to 2019. We're very excited to have him join and leading our statewide effort regarding testing. Testing goes hand in hand with contact tracing. We're very pleased. We've got a great leader from the private sector who capped off a fantastic career and retired, but not for long, because we've pulled him back into service here to serve his state. So we welcome Vern Dosh leading our contact tracing team. Vern served in the rural electric and telecom industry for 45 years. He was president and CEO of National Information Solutions Cooperative from 2002 to 2019. NISC is an IT company that develops and supports accounting, billing, and engineering software for more than 850 electric co-ops, telephone companies, and municipalities in all 50 states and Canada. So with his background on software and IT and his understanding of taking a systems approach, Vern is really going to help, because this contact tracing has got a big IT component to it. We're very grateful to have Vern and General Schulte on board, lending their expertise and leadership to complement our highly capable Unified Command, and they'll be reporting into our Unified Command leaders, Tammy Miller and General Dorman. Next topic is one, today is a day where we're all focused on the coronavirus. But today was also interesting because in markets that matter to North Dakotans made history today. There was some certain anomalies going on today in the oil price futures market, which oil price future market started trading on the New York Stock Exchange in 1983, so that's been going on for 37 years. A number of things occurred today that people would have never predicted. So as I said earlier, some people talk about statistical probabilities, and they call something very rare a black swan. It is more like a flock of black swans has descended on us, because this is certainly wasn't something that could have even been predicted a week ago. Everybody understood that we were having demand shock with a meaning that the normal worldwide consumption of oil has been slightly more than 100 million barrels of oil a day. So North Dakota would have been contributing about 1.5% daily to the world's oil supply. It's estimated that the demand for oil worldwide has dropped by more than 30 million barrels per day. So from 100 down to 70. You can drop demand faster than you can shut off production. That difference has been quickly, as they talk about in the industry, topping the tanks, meaning that the places to actually physically store produced oil are running out. In futures markets, contracts have end dates. Tomorrow is the end date of the contracts for May futures. And so people that had no place, that physically were long oil and had no place to store it, literally got themselves in a situation today where they had to pay people to take it. So not only did the WTI, West Texas Intermediate Crude, that's the price that North Dakota oil is based off of, was trading in the $18.23, I think, when it closed on Friday. Today it closed at minus 37. So this is a hard thing to comprehend, but at the end of the day, people that were left when the musical chairs was stopping in terms of the futures contract were paying $37 a barrel, paying $37 a barrel for someone to take their oil. So this is how it can drop into a negative price. The good news is that when you have, which is called not just cleverly, but actually academically, a contango situation. This has been labeled extreme contango, but this is a market options trading phrase where you end up with the current price being below the futures price. The fact that next fall's price is in the 20s and a year from now maybe even the 30s actually implies that people have a belief, a bullish belief, that the price in the future will be higher than it is now. That's a good thing, but still, for the moment, this feels a little bit like economic Armageddon for North Dakota, because we have such dependence on particularly at the state level, of paying for our state expenses with oil and gas tax revenue. To respond to this, we've called for an industrial commission meeting to be held tomorrow, an emergency meeting. We'll be considering at that commission meeting an emergency order to classify oil and gas produced at a loss to be considered a waste. This would allow oil and gas produced from wells at a loss that would be required to be shut in. That North Dakota Industrial Commission emergency order would be effective for 40 days. That's the maximum length that we can do this. And this again would prevent companies from being forced to produce at a loss, and protect the economic health of producers and help prevent bankruptcies. And when I say protect economic health, all the producers in North Dakota are already under extreme economic pressure because of the drop in demand that we've seen, and we as a state in partnership with them need to do everything that we can to help them remain viable, so that when we come out the backside that we actually have a functioning industry in our state. And again, when I say partner, we are, because the state of North Dakota works closely with that industry, and that industry pays a lot of the bills here in North Dakota. Unemployment claims, regular over the weekend, claims 1,654. The pandemic unemployment assistance, 257, nice to see that slowing down a little bit. And pandemic emergency unemployment claims, 370, brings the total regular claims to 56,700. And each of the PUA and PEUC around 7,200 and 7,600 respectively. We talked about this on Saturday. We processed another 20,000 payments. This is where we had to do the workaround, where we had 60,000 individual weeks worth that we were trying to work through, and we could only process them on the aging mainframe in chunks of 20,000. The amount that we got through, $12.12 million worth, should get to claimants today, April 20th, and then the remainder of those payments should be processed by tonight and paid tomorrow. That was to catch up on that $600 additional federal benefit. Going forward, we won't have to do a separate run because the $600 will be included in their regular weekly benefit now that we've caught up with that new federal program. Since March 16th, we've paid out a record $51.4 million in unemployment benefits. Tomorrow, we are expecting to pay out another $50 million, and this would include the regular unemployment payments, the FPUC payments, and the FPUC back payments for the previous weeks missed. And so again, that will be a record single day payout, $50 million going out tomorrow. So again, thanks to the team over at Job Service North Dakota, who's been working around the clock on the IT issues and to serve the record number of people coming in with claims. We think it's it's spring right now, and shifting into a topic away from the coronavirus, did want to provide a couple updates, because while we're in the middle of this health emergency and economic emergency, it's important that we remember other dangers that can come here. We've got landowners may choose to clear land, agriculture land, with planned burns. We know that there's a lot of stubble that got left out last year, but we in the North Dakota Forest Service want to remind North Dakotans to plan these burns carefully and use caution. And before proceeding with an agriculture burn, familiar yourself with the conditions and safety requirements required to comply with the North Dakota DEQ's open burn laws by visiting their website at deq.nd.gov, and then under that, search for open burning and the permitting required. Also, check on the ND Response website at ndresponse.gov for more information on ban restrictions and the daily fire danger rating map. Today, high winds created near critical fire weather in parts of the state, and you're not permitted open burn during burn bans or red flag warnings. If you're planning to burn, let local authorities know to avoid any confusion, because they often receive smoke reports from your burn. We want to make sure that the volunteer fire folks who are busy, often also doubling as EMS help, aren't or that they're alerted ahead of time. And we also, again, want to make sure that we're considering the safety of all North Dakotans. So let's work together to prevent wildfires and limit additional stressors to our emergency responders. Final update before we go to head towards closing is on behavioral health. And as we see these numbers increasing of the COVID positive results, families are being impacted. The media coverage has been intense. There's lots of misinformation around. We as adults often think that we know and understand everything, but lots of stories about how children may be feeding off of either parents' anxiety, whether it's financial or health or concern about grandparents. Routines have been broken up. Kids are out of school. They're not with their friends. They may not have been able to visit those loved ones or grandparents or their friends. But specifically, one of the fears that we know that children have is the anxiety over the unknown, or specifically the anxiety of themselves getting sick or fear of a loved one getting sick. It's important, if a loved one does get sick, to acknowledge the child's feeling is important. Your child may want to help their family member while they were sick. Encourage them to send letters, cards, art projects, or if your loved one is well enough, try a video chat. The behavioral health team has posted a new resource under their parentslead.org/COVID-19. It's got age-specific guidance to talking to your children when you have a family member who has tested positive from COVID-19. And of course, if as parents, sometimes that job itself gets overwhelming with all the other hats that you've got to juggle. And understand that, know there, been there myself. And if you need to seek out professional help, many facilities offering telehealth services can aid in addressing stress and anxiety. Contact your regional human service center for more information under nd.gov/DHS under Find a Regional Human Service Center. Remember also, of course, when you're busy taking care of your children at home, it's really important to take care of yourself. You are your child's #1 source of strength and comfort. So again, take care of yourself. You matter. Under the good news segment, as we know, a result of growing demand for PPE equipment, you've heard a lot about that. You also mentioned earlier that we had some things that kicked off in Valley City, designed by Valley City State University. It's been picked up by others. Gateway to Science here in Bismarck, EduTech statewide, supported by a Microsoft TechSpark donation, includes now a statewide network of school districts and universities who have 3D printers, laser cutters, and CNC machines that can create Department of Health approved face shields as one example of in PPE demand. Face shields are worn in addition to face masks to provide another layer of protection. The template was designed by Valley City State. These are printed. It takes only about an hour and a half, and they can cost less than $3.65, as low as $1. And again, thanks to the donation from Microsoft's TechSpark, the face shields will be provided free of charge. Likely recipients will include rural clinics, long-term care facilities, EMS, other healthcare professionals, frontline workers, and you can submit requests for PPE through the portal gatewaytoscience.org/ND-COVID-19. Partners have already received requests for 174 face shields coming in from Walsh County, Lemoore County, Lake Region, St. Thomas, CHI Health Home in Williston. These are all to be fulfilled by local school districts in those areas. And again, EduTech and K-20 Coalition will help organize tech departments to identify other projects to coordinate. Industry partners are also encouraged. And again, I want to thank Gateway to Science. And if there's questions on this, Beth Demke, who's the executive director, is here today. Thank you, Beth, for being here. She'll be available to answer questions. And I do want to demonstrate and share one of these wonderful shields that these are made all on 3D printers. So fantastic that the team has put those all together. And it could help slow the spread, could help save lives. So go team, go North Dakota. In closing, for gratitude, I want to close where I began, which is Patriots Day. Today is the first official Patriots Day in North Dakota. State law now designates the third Monday in April as Patriots Day and directs the governor to issue a proclamation to commemorate the start of the American Revolutionary War and the battles of Lexington and Concord and the shot heard round the world. I signed the legislation creating Patriots Day on March 19th, 2019. We had a ceremony on April 15th celebrating Patriots Day and designation, but because the law didn't technically take effect until August 1st, 2019, this is the first official Patriots Day in North Dakota. I want to give a special shout out to a couple of former news media folks, Representative Austin Schauer of West Fargo, who introduced House Bill 1169, and former broadcast journalist Jim Shaw, now a columnist for the Forum. They were part of the original instigators behind this revolutionary idea, and I want to thank them. And while we can't have a large gathering today, we can all celebrate and coalesce around the ideas and freedoms that can make our nation great, pay tribute to the heroes who fought and died to give those freedoms. And I also want to just say personally, when my kids were all young, on one of our family summer vacations that often had a history theme. I dragged my 3 kids out to the battlefields of Lexington and Concord, saw the bridge, saw where the first shots were fired, and if you ever get a chance to get there and see that, it's kind of amazing to think that how our country really got started. So shout out to all those original patriots that created this great country we live in today. Again, in closing, in gratitude, in addition to gratitude for all the revolutionary folks that helped create America and those legislators that helped support and pass this bill, I want to close with a gratitude quote from Margaret Cousins, which says, "Gratitude can make a day, even change a life. Your willingness to put it into words is all that is necessary." So again, take a moment to write it down, send a letter, send a note to someone, and find someone with whom you've got gratitude for. Let them know, and you may be the bright spot in their day. With that, we'll stand for questions. We're going online first. We've never done that before, but here we go.
Joe Bowen with the Grand Forks Herald. Some inmates at the Grand Forks County Correctional Center are destined for the state prison in Bismarck, but are being held at the county facility due to coronavirus concerns. They'd prefer to be moved to the DOCR facility based on programs and services. Do you have any plans to allow new inmates at the state prison? Is there available space there currently?
Well, one thing I want to just say and give a shout out to Leanne Birch and all the folks that work in our correction facilities. She leads our effort in North Dakota, and of course we've got facilities from New England to Jamestown to Mandan to Bismarck, and so far, you've heard news all over the nation about some outbreaks and serious outbreaks in the correction system, but we're very fortunate that that hasn't happened in North Dakota yet, and part of that's because of good planning and good execution. We did, in an effort to, as we say, de-densify, make sure that we had the ability to have space to isolate people if there was a case. We did, at the state level, stop receiving transfers from county to state for a period of time. And then as people were coming up on parole and their release dates, we were able to move people out that weren't a threat to the community and create some space. And that's, again, I would call that a best practice, so that if we do end up with an infection in one of those facilities, we've got the room to isolate people. So I would say that I don't have an answer today specifically about the Grand Forks transfers, but I just say I've been very supportive of the plan that's been in place. We've had great execution so far. We haven't had to divert any resources, testing or otherwise, to any major outbreaks in those facilities, and so we'll continue to manage that on a day-by-day. And we could even consider having being part of a briefing on the correction system as part of that, as one of these afternoon briefings going forward. But good questions. Keep them coming. But right now we're in the all clear mode. Lane, KX News, you guys back up and running? Okay, alrighty. Welcome, everybody.
So the mayor of Grand Forks said today that they received multiple complaints about the LM working conditions last month in March, and they said the city filed those with the state and said it was a state and OSHA problem. Did the state ever respond to those complaints?
I haven't seen those, but if we've received complaints, we'll absolutely look into them, and we'll see what category they might fall into. I don't know if they're if it's a labor issue or if it's a DEQ issue, but I'm sure we'll hear about it, and I'm sure we'll dig in hard on those.
As I'm sure you know, there were a number of protesters outside your office today demanding that you reopen businesses, or at least allow them to reopen. You've said in the past that you support their right to express themselves via their First Amendment rights, but that they should abide by social distancing guidelines. A lot of us were there, and many of the protesters were not abiding by those guidelines. I'm just wondering, do you think that they're exhibiting personal responsibility?
Well, I think the point of protesting is actually try to not to follow the rules. So I guess I'm not really surprised that they weren't practicing social distancing. But I have got great understanding and great appreciation and great gratitude for the fact that we live in a country where we have the First Amendment right to free speech. We've got the right to assemble, and I would say that what what they're asking for is what we're all fighting for, which is, how do we get our economy back fully opened? I again want to stress the fact that the majority of our economy is open, more than almost any other state, and maybe that's why it accounts for the light turnout that showed up today, because there may be an understanding that we have have kept more of our economy open than almost any place in the country, and we've managed it really, really well with a lot of emphasis on individual responsibility and a very light touch from the standpoint of the government. And we, going forward, the way through this thing is going to be, again, what we've talked about, which is the ability that we have to have increased testing, we got to have great contact tracing, and we have to have people to follow the rules when it comes to quarantining, because we could be, everything could be open, whether it's in May or whether it's in August, September. And if we have an outbreak, in a church, in a bar, in a school, in a restaurant, there's going to be closures, there's going to be mandatory quarantines, there's going to be all these things that are going to become a part of the way we have to do that if we want to protect those that are most vulnerable in our society. And I'm sure that the people that were there today also do care about those that are most vulnerable. And we, again, until we have the ability to really test and monitor anybody who's going into a long-term care facility, the 218, we're putting people at risk. I mean, people say, hey, open up a bar. Well, you open up a bar, well, then somebody goes home, and then their spouse works for a long-term care facility, and they go in, and then people die. I don't think anybody wants to be part of that connection. And with contact tracing, we might actually be able to trace it back to say, this is where they acquired the infection and where it came from. So we want to, again, proceed as fast as we can, as smart as we can going forward. So I'm completely sympathetic to their goals, because we share them, which is how do we get open as quickly as we can, and again, respect all the rights that they have to protest and assemble and free speech. Dave?
When you came into office as governor, you faced a fairly tough budget situation. How do you compare what's going on now with what you faced then?
Well, the good news is that our budget today is at $4.8 billion, is $1.2 billion less than it was before we took office. So the fiscal discipline been exhibited by our administration in conjunction with the legislature. We're at our spending isn't at high, so we have a better starting spot. We're also in a spot where we've got the budget stabilization fund at its max, which is also a good thing, because it was drained before. Now we got $720 million in there. So those are two positives. But all of we will not be able to escape budget cuts if we have $18 oil and production shut in. I mean, because it would be impossible. And of course, there's many other governors are hoping that the federal government might pass legislation to replace revenue, replace revenue for states that have lost revenue. That legislation hasn't happened yet, but there would have to be a monumental amount of support for a small state like ours to cover what we do, because our revenue from oil is two things: it's price times volume. And if price went from 50 to 30, our volume didn't change. But if you're talking about trying to shut in what could be the vast majority of the wells in North Dakota, and we see a production drop at the same time we see a price drop, those two factors together is going to be an economic challenge like we may not have faced before. Okay, follow up to the economic question?
Yep.
Okay, coming from online.
April Baumgarten with the Forum of Fargo-Moorhead. Do you plan to call an emergency session to deal with budget shortfalls? And can we expect furloughs, buyouts, or layoffs for state government?
Currently, same answer on the special session. Don't have any plans to call a special session. And the reason being is that we've got a number of mechanisms that are in place. The Legislative Council, legislative leaders have all also shared this view, which is we have the ability through the allotment process and through accessing the budget stabilization, we can get a long way forward without having to call a special session. And calling a special session until we really understand the size of the problem and the amount of federal relief, probably then we'd be shooting in the dark on, you know, how much to cut and what to cut. And so this is a case where we know there's going to be challenges in the future, but we have to have the patience to let it unfold a little bit before collectively we could get everybody back together. Not to mention that right now it would be a challenge from a distancing standpoint, given the existing facilities and what would have to be done in terms of sort of video meetings to make that happen. Jacob, or?
April stole my question.
Oh, April, way to go, April. Okay, you stole Jacob's question. Lane, did you have your hand up, or was it? No, okay, you're good. All the way, we got in the back, okay. Travis, thank you for being here.
About the Care 19 app, is it meant to be updated at the end of each day to show where the person was? Mine was off the other day when I was at work, and I got home that night to update it. And it showed that I was someplace else all afternoon. It showed I was at the Elbow Room Bar, and I was not at the Elbow Room Bar. But is it meant to be pinpoint accurate, or is it meant to just be updated at the end of each day by the user?
Well, the goal is that it gets more accurate with user input. But I do know that it's called this version 1. There's another version that's coming up. There have been some reports, and anybody that is having geographic accuracy reports, as Travis was reporting. I had a few of those myself. I've sent those in to Tim Brookins at Proud Crowd. They're using that data to refine the algorithm. I think that there is something I believe what is happening is when it switches cell towers, it may indicate that you've stopped at some place when you haven't actually stopped there. The recommendation is to go into your selection and collect Alone Other and hit Alone Other in the app, and then that will then essentially understand that that was not a place that you stopped, or not a place that needs to be kept track of, because you would have had no opportunity for contact tracing. If it is work, where you can select that this is my place of work in there, then if you're having an issue with that actual address, that'd be a good thing to report. Okay, we're going to Jeremy and then back to Dave. And then online.
So I believe this was a question asked last week, but how sure are you at this point that we are either nearing the peak of the cases, of new cases, or that we're at the peak of new cases?
I'm not sure. And I think the way we'll know we're at the peak is after we start going down. I mean, that's the only way you know when you're there. There's so much uncertainty. That's why the predictions are very hard in this dynamic environment. We also know that we have to understand I would say the math dilemma that we're in, because we could actually be in a spot where we'll have days like we had Thursday, Friday, Saturday, where we're going up, the rest of the country's going down, but our up is below their down. And so you may have, we're also going to have to look, and this is why we began talking to the other regional Midwestern governors last night from some of the other low count states, which is the federal guidelines actually work better if you're in New York or New Jersey and you've had a big peak and you're on your way down, than if you were someone that was very flat the whole time and you're kind of bouncing along the bottom. The trends may not indicate as much. So, and again, we've got so much hospital capacity. We again, the federal guidelines are guidelines, they're not rules. We'll make decisions for North Dakota that are best for North Dakota, and we will continue to see some of those numbers pop up when we're doing the targeted. When we're out searching for positives, we'll see the numbers pop up. When we get more broad-based testing in, we may see the numbers go down, because when we get the targeting, we'll get the numerator to go up. The broad-based testing will cause the actual percentage to drop. And so we want to do both of those things. We want to be really searching for positives, and we want to be making sure that we are really cutting a broad swath. Particularly an area where we've got to dial up more is we've got to make sure that we're testing everybody that's working in long-term care facilities. We're so fortunate. We've had only nine facilities out of 218 that have had a positive from either a staff member or a resident, but we have to do even more to protect those people that are in there. We've named Chris Jones to lead our vulnerable population protection task force, if that's kind of the working title for that group. And we'll in the coming days we'll hear a full report from Chris, because we've got to do even more than what we have been relative to those long-term care facilities.
And now, and if anyone's interested, that list is now on Health Department's website.
Okay, so it's up from 10 when I got briefed from 9 2 hours ago. So we got really up-to-date information here. So now 10 long-term care facilities, and it's on the North Dakota Health thing. Okay, thank you, Mike. Question online?
KZZY in Devils Lake. Given that medical experts are saying it will likely take at least 18 months to come up with a vaccine, what will the state's acceptable level of risk be to achieve a new normal?
Well, I guess for Eric, that's we'd have to define accessible level of risk. I think that we are, again, wanting to protect those that are most vulnerable, which is maybe gave some of that in the answer I just gave to the prior question, which is we have to make sure that we're able to protect those that are most vulnerable. And one way we do that is making sure they don't get it by protecting them in the long-term care facilities. The other is making sure that we've got plenty of intensive care capability, because that's the way that you can save lives. And we've done really well on the second part of that, is making sure that we've amped and increased our amount of intensive care and the number of beds we have. And because we have that capacity, that allows us to think about taking more risk than we might have in the past. And I say not more risk because we're not want to risking people's lives, but we can take more risk of people having potential exposure to the infection by reopening the economy. Because when we reopen the economy, there's going to be more transmissible moments, and there's more risk. Because in May, the virus will still be here, it doesn't magically go away, and it will still be as contagious as it is now. We will just be in a place where we've got more PPE, more healthcare capacity, better understanding, better testing, better ability to come in and close things down if there's a hot spot. And we'll have developed new skills and new approaches that allow us to essentially manage a chronic disease. I mean, it's chronic as the pandemic is chronic in that it's not going to go away. Acute would be like, oh, this thing was here for March and April and now it's gone in May. No, it's not like that. I mean, we've got to be managing this as a society and as a state for until, as Eric says, until we get a vaccine, and that could be 18 months. Maybe it's faster, maybe it's slower. But when it comes, then you've also got to when you have a vaccine, then you've also got to build up production to produce that vaccine. In the day that you have the vaccine and it works, you're going to have something like 7 billion people that probably want the vaccine, or at least 1 billion of the most vulnerable of the 7 billion on the planet, and that will be the most widely produced vaccine ever. That will take some time to do that. So we got to keep working on our skills to allow us to reopen and live with and manage under that new normal. How do we live with a highly contagious disease? Jacob?
With that advancement in management and trying to keep up with contact tracing, obviously there's still demand from all other states to get increased testing supplies and whatnot. Has North Dakota reached out to foreign countries to get additional testing or supplies like that?
We haven't, and we're confident that throughout this week we're going to be able to announce that we've got enough supplies to meet our increases in testing here in North Dakota. So we feel good about the trajectory we're on in terms of testing capacity. Dave?
It's an odd one because I've had about a half a dozen questions about this, so I thought I'd pass the question along to you. We have April coming, and April's here, and that's also kind of a start of rummage sale season. So do you have any guidelines for people who want to hold rummage sales?
Wow, have not given any consideration to rummage sales, so I'll have to take that one under consideration, because they wouldn't fall under any of the closure guidelines that we have. I'm just thinking on the fly here, Dave. That's always dangerous, but we wouldn't fall into that. And again, but could you manage it in a way where you could maintain social distancing and how you manage payment and crowds less than 10? I know some rummage sales draw quite the crowd, so that'll be interesting. I know some cities have even talked about whether they're going to have or not have cleanup day in the spring. I would guess there'd be quite a lot of demand for that. I'm sure there's been a lot of home improvement projects that have been going on here around the state during this time frame, but those will be all things we got to sort through. But that's a good question. And I would guess in the end, that one may be a city by city decision. We'll go online and then back to Jacob.
Jean Schemp with Hometown Radio Group. Other states have begun adding deaths as suspected of being COVID related. When it comes to deaths listed in the state of North Dakota COVID-19 report, how does the state determine whether those deaths are COVID-19 related?
Jean, Mylon Tufte's not here today. I'll have to get more information on the death coding as that relates to your specific question. I think that she asked a good question because there are right now no plans in North Dakota to do what New York or other states have done, where I think they added 3,700 deaths or something in one day and said these are all the ones that we had flu-like symptoms. We think they were COVID, so we're just going to put them into that category. I think that we want to have a greater degree of certainty around that. At least I would on that data, and so we don't have any. There's been no discussion or plans around to do that. I do think that we do have to think about people who are dying from COVID versus people that are dying with COVID, because if you've got we've had some cases already where people have got multiple underlying health conditions who are already in hospice, who then they've got a form of pneumonia or flu-like symptoms, and then they get COVID and they're positive and they pass away. Then that might be a case where someone died with COVID as opposed to from COVID. But it doesn't take away the hurt, so I don't mean to be too clinical for anybody who's lost a family member, but I think it's important for us to really try to assess assess the nature of the virus. So it's part of that information we do need to have and understand. Jacob?
There have been growing concerns over flooding this spring, and with rivers expecting to crest later this week, any concern about following social distancing policies while also being able to fulfill sandbagging operations?
Well, the good news, and I'm sure you're asking about the Missouri, the good news is we got through that on the Red River and James River, and again, it's tough. Having grown up and spent a lot of my life and majority of my life in the Red River Valley, I got way too good at sandbagging, and so I know it's hard when you're on a sandbag line to maintain that distance. So again, would people try to exercise caution? I mean, gloves, masks, again, or if you can manage with a bobcat as opposed to a line of people stringing bags, handing them directly to one another, on the old sort of bucket brigade approach. That would, all those things would be a smart way to approach it. But again, we just have to figure out a way to do the things we have to do as North Dakotans while we're battling this thing, and hopefully we'll continue to have, as we've had, a near perfect melt. I mean, we had record fall conditions, and we could have been in for a whopping flood season at the same time we're dealing coronavirus. And I know we've had other governors have had multiple major tornadoes at the same time they're doing this. So I feel like that again here in North Dakota we can be grateful that we've avoided some of these dual calamities at the same time. One more question that'll come from online.
Tom Simon with Williston Trending Topics. With all the difficulties in the oil industry we learned about today, what would you say to workers in Williston and Watford City who may be wondering if they should stay or if they should look for work elsewhere?
Well, I think that if you're working in the oil industry and that's your skill set, the sad part right now is there's layoffs here, but there's also layoffs worldwide. I mean, it's not like this is not one of these cases where you can go to the Permian or the Marcellus or Oklahoma, Texas, go someplace else and find a job, because this is a catastrophic to the entire industry worldwide. And so for those that are here, Again, we are optimistic, particularly when you look at the prices for next fall and a year from now, that they're, at least the market thinks that the people are going to start driving again and start flying again, and that demand is going to come back. Ships are going to start moving across the ocean, hauling goods, as opposed to right now. Most of the oil tankers in the world aren't hauling oil across the oceans. They're being used as stationary storage. And so we are in a if we're not at the bottom of the pit, we're getting close to the bottom of the pit relative to where it would have to be in the oil industry, and start working our way back. Whether you are here or in another state, unemployment's likely to be similar because of the federal kicker. And so if you're here in North Dakota, we'd love to have you stick around, and hopefully we'll get back on our feet going again forward. But this is going to be tough on workers, on companies, and on cities in the Bakken and any place else in the nation that we're highly dependent on that industry. Okay, with that challenging note, let me just again close with a happy Patriots Day. In spite of the short-term challenges that we have, we know that we can be optimistic that if there's any economic system that can rebound quickly, it's going to be capitalism, and that we're going to have all the right incentives and all the innovation. With disruption comes innovation. I think there's going to be a lot of exciting innovation that comes out the backside of this, and whether that's leaner and more efficient government, or whether it's new ways in which we think about connecting and staying connected with our own families. There will always be some positives that come from these trying times. None of us enjoy change. We're humans. We like it the way it was yesterday, as opposed to desiring it to be a lot different tomorrow, for the most part. But this has been a lot of change that's been forced on us. It's going to be a period of discomfort. But I know that if any state is going to come through it, it's going to be North Dakota. And again, I want to thank all the citizens of the state for the great work that they've done under North Dakota Smart, because that's one of the reasons why we've got some of the best numbers in the country. And we're going to keep on that track as we work to get our economy back up and going again, as we work to keep everybody safe. So with those dual objectives, working on the and, not the or, we look forward to seeing you here again all tomorrow at 3:30. Thank you all.